Hello everyone, we're gonna discuss interesting facts about diabetes in this video. So I think let us go point wise. 5 interesting facts about diabetes that every person should know, even if you are having diabetes or you're not having diabetes. Fact number 1: if you're not consuming sugar, you are not the person who can have a diabetes. So it is sadly very much wrong fact. We all Asians, we all Indians sadly having genes of having increased risk of diabetes. So you have to have a very much healthy lifestyle. Even if you're not eating sugar, you can get diagnosed with a diabetes. So I see many of the patients who are getting diagnosed with the diabetes for a very first time. When they get to know that, oh my god, I'm having diabetes, then they really fumble up and they say, no, I am just not at all eating sugar and I can't have a diabetes. So it's blunder. Blunder number 1, I would say. Let us make move. Blunder number 2. Interesting fact I heard from my patient. Her doctor told her that her sugar levels are going low. So she is not having diabetes and she should actually start including sugar in her diet. So I think there are two possibilities. One is doctor might have said something in a funny, sarcastic manner, and my patient really took it seriously because she might have got so much of happiness to hear finally that her sugar levels are gone down. And point number 2, I don't know what's the issue with that doctor, but he said something which I will say from my point of view. It's nothing to criticize anyone. It's my point of view that was incomplete advice. So if you can really tell something to your patient about this situation, then I will prefer to say that if your sugar level is okay or if your sugar level is going down, we have to work so much, okay, on your sugar levels to make your sugar levels normal, within the normal healthy limits of blood sugar levels. So even if in case it is going on the lower side, it is not advised to include refined sugar or a simple sugar in a form of sugar, honey, jaggery, or sweets in your diet directly. No, it is not the way. Okay, there are other options as well by which you can grade up or you can make your sugar level neutralize, and we really have to work on individualized basis in that case. Okay, so don't do such kind of blunder. Even if you are having a diabetes, this is a situation which is called as the hypoglycemia, in which the person goes on the lower side. Okay, the sugar level goes on the lower side, and this is one of the alarming factor, because many of the diabetic patients who are not at all aware about their sugar levels, they really get admitted into hospital because of the hypoglycemia. So patient has to be properly educated about the hypoglycemia and how to manage hypoglycemia. Eating direct simple sugar every day is definitely a terrible thing to do. Okay, so don't follow any incomplete advices, rather, what I would say. Point number 3, my sugar level is no more on the higher side. My sugar level is low, so my diabetes is gone. So it's one more blunder, and I think it is not so. As I said, hypoglycemia is the situation when your sugar levels go on the lower side. Hyperglycemia is a situation when your sugar level goes on a higher side, and both these things do happen when you are having diabetes. And my job is, being a dietitian or being a diabetic educator, my job is to help my patients achieving normal steady level of your blood sugar levels, which will not fluctuate in between so much higher or so much lower. Okay, this is what should be done to make your body least suffer from all the consequences and health results of diabetes. Okay, and I'm fit, I'm having diabetes, but I'm fit, so I need not follow any kind of restrictions. I see a lot of this kind of patients actually. Patients, peers, family members, relatives, lot of people around you. So actually diabetes is a silent killer. Okay, it do not gives you any symptoms externally. Like if you are injured, you will see injury marks, bleeding. Diabetes will not show any kind of symptom. It is still there inside your body. relaxed inside your body, making you unrelaxed. Okay, so you have to be careful in diagnosing diabetes basically, and it is silent killer, as in it starts killing, all your internal body organs slowly, 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 like your eyes, your kidneys, your heart, everything. So what happens is, mainly the patient get to know that something is damaged when something is not functioning. Like when a person actually, excuse me, when a person actually lands up in having a kidney failure, then a person knows, like, yes, I was having diabetes last 30 years and I was not following anything, so I am having kidney failure. So it took 30 years, to progress further in your body, to make those worst metabolic changes in your body that made your kidney suffer. So you have to wake up before your kidney and your eyes and your heart suffers. So for that, I'm here offering online consultation of extremely beneficial diabetic control and management packages under my own brand Green Apples. So anyone who wish to avail my packages and my services can really get to me by obviously the things I will show at the end of the video. So this video is basically to give free health awareness among all the Indians, because just we are having little bit more genetic susceptibility of having diabetes, and we have to beat it. We have to control ourselves. We have to maintain healthy life. So I work in preventive sections to control diabetes, not to have a diabetes, and to manage diabetes.